Situation in that Dorval facility is the most extreme that we've heard thus far in the pandemic, but we are also hearing many disturbing stories from many other long-term care facilities across the country. Michael Serapio taking a look at the national picture for us. Michael, this may be, well, a wake-up call, I suppose, as we look at the situation nationally. What are federal officials now saying?
Well, certainly they are looking at toughening guidelines right now, Heather, and that's because when you look at the number of COVID-19 deaths in this country, nearly half are the result of seniors who were in some type of care facility who died because of the disease. And those numbers keep growing. Yes, we have seen over the weekend the Maison Edon in Dorval, but we're also talking about deaths at care homes in Toronto, 5 alone at this facility, at Gibson House, deaths at care homes in the National Capital Region that happened this weekend at Calgary's Mackenzie House, not to mention the tragic cases that we've been talking about for nearly 2 weeks in Bobcage in Ontario, and the earlier cases at the Lynn Valley Care Centre in North Vancouver. Now, this news, those numbers, they have not escaped anyone, including the Trudeau government. Take a listen to the Deputy Prime Minister, Chrystia Freeland.
People who are resident in long-term care homes are a particularly vulnerable group of Canadians, and we have been working very closely with the provinces to put in place measures to protect the safety of those people.
Now, she was talking about measures, and they were introduced by Canada's National Public Health Agency, essentially laying out the fact that going forward, the number of visitors had to be limited when it came to seniors in care homes. In fact, people are being advised to stay away if they can. To the personal support workers, they are being told now to wear PPEs like masks as they deal with the residents in these homes, as well as limiting where they work. Many care workers actually work at more than one facility, and the new guidelines essentially tell them you have to work at only one facility during this pandemic to make sure that the spread is actually limited, and they try to mitigate what is happening with the deaths of COVID-19, Heather.
Will this be enough, though, Michael, to address the workers' concerns about their safety and the residents' safety?
Yeah, and that's a big question. And really, we've been talking to advocates all throughout the weekend, trying to get their measure as to what they think. They actually believe that these new guidelines will not be enough, and that's because there are a number of issues that they're dealing with here. First and foremost, the fact that personal care workers at these residences, they're not paid a lot of money, and also the regulations across this country is fairly checkerboard because it is the province that actually regulates senior care facilities, senior care homes, and the regulations as to the number of workers against the number of residents, that varies, as does the training. A lot of concerns being expressed by advocates. Take a listen to what we heard from them.
Unfortunately, we have a system that across the country has been grossly underfunded, and a system that doesn't even give its own workers, for example, full-time wages and benefits.
We're seeing levels of care or numbers of personal support workers, 1 to every 42 residents inside a nursing home. And that is absolutely impossible to take care of.
So did the shortcomings become created by COVID-19? Advocates say no. Yes, residents have been dying because of COVID-19, but these shortcomings, all the disease is actually doing is exposing these shortcomings and this underfunding that has been a long-standing issue in this country, and essentially proving that the system as is not strong enough to fight the challenge of COVID-19.
Michael, thank you.